goma taboa. Baraka goma boa. Kameka goma taboa. Baraka bubo su bogo amene boyomo. Yeah, toyo, 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 mobe. I'm in a miracle, boy. You're coming up, boy. I'm a coming up, boy. What about you, never? Yo, yeah, bro.
Bayelsa, with a population of about 3 million people spread across 8 local government areas, adequate and prompt health delivery has always been a challenge since the creation of Bayelsa State. However, since his assumption of office as governor of Bayelsa State on February 14, 2012, Governor Henry Serake Dixon pledged government's commitment to provide adequate world-class healthcare delivery to Bayelsans all the way down to the grassroots.
In the last 4 years now, almost 5 years, we have embarked upon an aggressive and ambitious program of infrastructural development in the healthcare sector, the diagnostic center. Anything you want to travel abroad to do, you can do it here. And the hospital, the government house hospital that is there, wonderful. The public wing is there, the executive wing is there. So much is happening. The referral hospitals in the local government areas.
The idea of the referral hospitals is to ensure that you have hospitals that are not only well equipped, but also well staffed in a way that people from the neighboring communities can be referred to those centers and have basic things done, like surgeries and some specialist care, not just general medical care, but also specialist care. That's why they are called referral centers.
And we're talking about 60-bed hospitals. We have a general hospital that we are building, except that of Nembe local government, that what we're doing is to refurbish and had additional projects in there like doctor's quarters and the rest of it. But in the other one, newly built by this government, in all the local government.
This commitment is driven by a clear vision
of our governor, Henry Serake Dixon. It's a restoration government who has a vision of good health for his people. And so therefore, upgrading all our health facilities, it's of utmost importance to him.
In its genuine bid to actualize this vision, the administration of Honorable Henry Serake Dixon has put in place new medical facilities as well as renovated old and dilapidated ones around the state, thereby making good its promise to the people.
The vision actually is to ensure that the capital flight that has plagued this country in the health sector, is somehow eliminated, both at whatever level, whether for the rich, for the middle income earner, or for the poor.
It is in line with this vision that the new Government House Specialist Hospital has been built and equipped with state-of-the-art facilities.
There were existing facilities, and we saw that even though there were facilities, they were not to the standards that we needed. For instance, this building we are sitting on now was a bungalow with 2 wards. But now you can see that it is now a duplex with several wards. And then we started another wing, the general wing, just a stone throw from this place. And then there is a connection between that wing and the VIP wing.
In the public, that's where the patients comes in. So we have the accident emergency, we have the outpatients, we have all the facilities that need, the ward, the female ward, the male ward, the pediatric, the ONG, all the services that you expect to take place in an hospital will be operating from the government house public. The pathway of care for patients will be executed.
Aside the world-class facilities, the new Government House Specialist Hospital also has well-trained and qualified personnel to deliver quality healthcare to the citizenry.
Biggest part of our core mission is to train Bayelsans in healthcare, doctors, nurses, and other technologists on the latest technologies when it comes to healthcare delivery. That is safe and efficacious healthcare delivery. We, to achieve that goal, have to ensure that all the trainees, doctors and nurses, and technologies are starting on a similar platform. One of that platform would be to ensure that they know the basics of basic life support and advanced cardiac life support. So that those are training techniques that they really should have a handle on. Usually in the hospital setting or sometimes outside the hospital setting, patients can suffer urgent, sometimes emergent conditions that can render their life at risk. The doctors and nurses trained in ability to provide basic life support and advanced cardiac life support sometimes can make a difference in the patient surviving a cardiac arrest or even other issues that may require immediate medical attention. So it is the first step. So when I came in this time to Bayelsa about a week ago, we've had continuous training of the staff at the Government House Hospital complex here with the ACLS and BCLS program. I brought some expert trades from the US who have been gracious enough to help train our doctors and nurses. In addition, we also had multiple sessions for medical lectures to advance healthcare delivery for our doctors and nurses. We had telemedicine connectivity from the United States to the hospital complex here in Bayelsa, and we're able to present medical lectures and educational forum that way.
The Bayelsans are aware of what's available for them to ensure that they gain access to the health facility that is in hand for them. So by doing so, we create great awareness, outreach, bringing awareness and also bringing in qualified medical personnel to the state to work with our people in collaboration.
In addition to that, and with its desire to sustain the huge investment in the hospital and the health sector generally, the government has gone into a partnership with a globally recognized outfit, Oasis Global Network, based in the United States, to manage the hospital.
Governor has invested a lot of time and energy as well as capital in ensuring that the healthcare system in Bayelsa is transformed. To this end, we have developed special services in addition to general medical services for the hospital.
I'm an operating room nurse in surgery, and I think that's very important that we have qualified surgeons, we have qualified staff, and we have the proper equipment to do the cases. And I think we can bring nurses in here to help, and I believe that we could take nurses with us and where they can see and train them also.
Get the surgical department organized and up and running for the hospital. The staff has been more than receptive. They are so eager to learn. It's amazing. We're very anxious.
And I'm teaching basic life support and advanced life support to the doctors and nurses and the medical personnel here at the Government House Hospital. Well, the process is the same internationally. It's from the American Heart Association, and it involves basic life-saving procedures when a patient becomes pulseless or apneic, which they're not breathing, and methods to revive the patient's life status. So it's very exciting that this should happen, and we're just going to see how it goes.
Bayelsa, obviously, is building a new reputation for itself as an emerging medical hub, as visits to the various health facilities initiated and put in place by the administration all portend a bright future for the state.
It's the first time we're having dialysis facilities in the state, and you can see the wonderful team of experts, our partners from the US who are here to operate it. You know the diagnostic center is there. You also know of the referral hospitals in every local government. So we are set. Bayelsa is set for quality healthcare delivery.
One thing that's particularly dear to me and to the governor is stroke care. In Nigeria and the world as a whole, stroke is the third leading cause of death. If you have a stroke event in any of our cities in Nigeria, you're probably condemned to death within 2 weeks. So one of the things that we want to do or provide is to ensure that our facility in Bayelsa is top rate, world class. So if you have a stroke event that occurs and you're able to find yourself within the confines of our institution, within 3.5 hours of when that occurs, you have a very great chance of surviving that event. Also, the governor, to his credit, opened a wonderful world-class diagnostic center, and the equipment in that facility is top rate, excellent CAT scan machinery, excellent MRI, excellent ultrasound system. And when you talk about stroke centers, the most important thing in stroke is to decide whether or not you have what we call an ischemic stroke or hemorrhagic stroke. There's a difference. If you have a stroke and the person does not have bleeding in the brain, you can treat those person aggressively with what we call TPA or tissue plasminogen activator, which is a chemical that will bust a clot and reverse the stroke symptom within a short time, and they can regain function. That's one of the services we'll provide here. And our ability to work with the diagnostic center to get all the imagery done, CAT scan imagery within a short distance from this facility would be of tremendous help. So we're looking forward to provide excellent stroke care here in Bayelsa and for all Nigerians and even persons from outside Nigeria. We want this center to be the top #1 stroke center in West Africa.
The silent revolution of Honorable Henry Sirake Dixon-led administration in this very critical sector also has an unparalleled and remarkable presence at the State Diagnostic Center. The center, which has some of the best facilities anywhere in the world, also has professionals in the various departments.
We are building Bayelsa for the future, and this is one of those futuristic projects. With this facility, no Bayelsa needs to go outside this place for diagnosis.
It's a full-service comprehensive diagnostic center. The services are in radiology and imaging, which is getting CT scans and MRIs. Those are big tests. Also in the lab, we have a fully automated lab system. So we do assays for prostate cancer like PSA. In breast cancer and breast care, we provide digital mammography, which is the screening test for women with breast lumps.
This is a 160 slice CT scan, Aquilium Prime from Toshiba. I think holistically it has an excellent workflow and also has an EDA, a software that is adaptive iterative dose reduction. This software helps reduce the dose that is being absorbed by patient at different tissue density and different parts of the body being scanned.
In the conventional X-ray room, we have a Toshiba K-stream machine. We also use it side by side with a digital machine, a computer radiography machine. The Toshiba K-stream machine can do all the conventional X-rays, and because it's digital, the image quality is optimal, and then patient time is actually reduced. In the mammography units, we have a metatronical light load machine, and basically mammography is about using low dose radiation to image the breast for early detection of any breast disease, and very patient friendly. The angulation, the height can be adjusted to suit with each patient.
In BDC ultrasound suite, we have a Aplo 300 Toshiba. The Aplo 300 It's one of the best in the market for now, and it came with 5 probes. We have the cardiac probe. We do cardiac as in the chest ultrasound, is an user word, and we have a 4D probe. By 4D, we are talking about real time.
Modern equipment you should find in any international radiology center today are available here. This center has what we call the MRI machine. One of the best innovations as far as medical imaging is concerned in the whole world today is MRI. MRI simply means magnetic resonance imaging. In this center, there is what we call a 1.5 Tesla MRI. In terms of routine MRI services anywhere in the world today, even in the very developed countries, most of it is done using a 1.5 Tesla MRI.
ECG department, basically we do a rest or a stress ECG or an echo for our guests. When they come here, depending on our referring physician instructions, either they're coming for a rest or a stress. So whichever one they are coming for, that's what we do for them.
Endoscopy is a visualization of the internal organs of the body, precisely the GI, gastrointestinal organ of the body. It's divided into 2 parts. We have gastroscopy and colonoscopy. Gastroscopy is a regular one. You put a scope through the mouth, and then we visualize the esophagus down to the stomach, down to the duodenum. And then colonoscopy is I think that's the one that scares people the most. Visualization of the colon, starting from the anus, that's the bottom. The scope goes through the bottom. We try to visualize the colon, that's the large intestines. So that's what we do during colonoscopy.
This facility not only cater for the people of Bayelsa State, I think for the whole South and the nation in general, the relevance of this center cannot be overemphasized.
I am very impressed with the facility. I think it's going really well. The quality is better than some facilities in the States. And so I'm very happy to be a part of that. And the fact that they're trying to have the culture of giving not only quality care, but giving good customer service, actually caring about the guests that come here and making sure that they get appropriate care and not unnecessary care.
I am very confident in the services that we provide. I'm very confident in the equipment that we use because it's state of the art. I'm very confident in working here. I know where I'm working. I know I'm proud to work here. I'm very happy to work here. Otherwise, I wouldn't be here if I didn't believe in working here. So I definitely would recommend it to everybody. Everybody that comes in, whether you're from, we've had guests, believe it or not, from the States, and we've had guests from as far as Lagos, which is within Nigeria. And I always try to sell the service, and they're so impressed because they didn't actually think something like this exists in Nigeria, better yet in Bayelsa.
This is indeed an opportunity waiting to be discovered and be put to maximum use to serve the healthcare requirements of Bayelsans, Nigerians, and even beyond.
But we have gone around the facility and looked at the quality of equipment available here and the professionalism and enthusiasm of the staff. And I have to say I'm extremely impressed to see a facility of this quality in Bayelsa. Some of the facilities are absolutely state-of-the-art, very modern, very sophisticated, and above all, I think we have seen staff who are very well qualified in what they are doing, very many years of experience, some international experience as well. So a combination of great facilities and competent staff, I think it's been quite welcoming. I'm actually very pleased I came here.
think it's very important that any governor uses the resources of the state and of the government, the taxpayers' resources, to deliver services for people. And I'm pleased to see that Governor Dixon is building facilities like this, and I think it's really important that the citizens that voted for Governor Dixon get what they want and feedback to him on the kind of services they need: health, education, security, and so on. In the end, governors, and Governor Dixon said this himself, are there to serve the people that elect them, and they're there for them. And we at the British High Commission are very clear on the need for accountability around governance, and that's what I hope what people can see.
The issue of fake and expired drugs still finding their way to the market has remained one of the most daunting challenges of healthcare delivery in Nigeria. In a further demonstration of its genuine desire to fulfill a holistic healthcare delivery system that will stand the test of time, the government is already taking steps to stem the ugly tide of fake and adulterated drugs.
There will be a drug delivery value chain. Okay, there will be distributors. People will come from far and wide, and we are hoping that Bayelsans will take advantage of this and be the ones who will take charge of distributing most of our drugs, not only in Bayelsa State, but also to other states, because all the manufacturers' representatives will be here to ensure that we have the drugs given to all facilities and all types of drugs. The only drugs we might import are the ones that are not manufactured in Nigeria. So basically, the essence of providing this kind of facility is also to provide jobs for our people.
Interestingly, as sophisticated and modern as these facilities, the Restoration Government of Bayelsa State is equally working round the clock to put in place the legal framework and policies to make these facilities affordable to the common man on the streets. The Bayelsa State Health Insurance Scheme, which has been passed by the State House of Assembly, is another laudable initiative of the Restoration Government in the health sector. The scheme, which has very competent people managing it, is intended to make healthcare facilities extremely affordable for every citizen and resident, and also for them to have easy access to these facilities.
His Excellency, the Governor of Bayelsa State, has rolled out a very well thought out insurance scheme for Bayelsans, not only in the formal sector, but also in the informal sector, so that by the time all these projects in the health sector are rolled out, people will be able to access them through the health insurance scheme. By the time we flag off some of the questions about access to all these state-of-the-art facilities we're talking about will come to light, and people will know how they can be assessed. So we don't expect people to come to these facilities and put their hands in their pockets to bring out money to pay for these services. The health insurance scheme that is being rolled out is the Bayelsa Health Insurance Scheme. It's going to take care of all that. So it's well thought out, and I believe we'll be seeing the dividends and the deliverables.
To participate in it is not a difficult thing. We'll start registration of all civil servants, and they are going to be given cards. All civil servants will have the opportunity of having 4 of their biological children and their spouse as part of whatever they are going to pay. The least for a grade level civil servant is 400 naira. So with a minimal amount of 400 naira, 6 people in a family will benefit from the array of health services that the insurance is going to cater for. So it's a very laudable project. It's a very laudable thing that we should all encourage the governor to do, because it's going to be of immense benefit to our people health-wise. And then the scheme also have a space for vulnerable people, elderly above 70, and then children below 5. Those are the vulnerable citizens of our state. The scheme covers those people. They do not pay anything. Whatever the formal sector or whoever is involved is pay covers for all.
If the old idiom, health is wealth, is anything to go by, we can rightly say that Bayelsa is clearly moving in the right direction.
Efforts are being geared towards ensuring that facilities that will take care of virtually every need at those levels are being put in place.
And the need to give answers is what we owe society. So that at the end of the day, we'll look back and say, these are the legacies that we are leaving behind.
The vision and mission of the Governor Henry Serake Dixon-led administration is to properly position Bayelsa for a greater, healthier, and a prosperous future. Bayelsa is clearly on the rise, and time will tell. Welcome to Bayelsa, the emerging health tourism destination of Nigeria.
I'm gonna